Hello everyone, I'm Dr. Y. Coney and welcome to Bright Star Baby and Child Clinic. In this video, we will talk a little bit about jaundice in newborn. Jaundice in newborn is a condition that is fairly common that can sometimes be quite serious and severe if left unmanaged well, okay? So let's dive in and we'll first talk a little bit about what is jaundice. Jaundice is a condition in which the skin or the whites of the eyes and the mucous membranes turn yellow because of high levels of a component called bilirubin, a yellow bile pigment that comes from the breakdown of red blood cells in our body. Now, normally, the liver is in charge of breaking down this excess bilirubin. However, if there are too many breakdown of red cells or if there's something wrong with the liver, then this can cause jaundice. Now, in normal circumstances, the newborn will produce more bilirubin than adults because of the greater production and the faster breakdown of red blood cells in their body, especially in the first few days of life. And in normal circumstances, the liver will filter the bilirubin from the bloodstream and release it into the intestinal tract or the gut. Sometimes the newborn's liver can be quite, because of the immaturity of the liver, they can't do their job very well. So they can't remove the bilirubin quickly enough. And so it causes a build-up of bilirubin in the body. So jaundice that is due to this normal newborn condition is actually called physiological jaundice. So it usually appears around the second or third day of life. That's normal cause, okay? Now, other causes that are not so benign or can sometimes be serious would be, for example, if the baby has an internal bleeding that we don't know where it's from yet. So if there's lots of bleeding, there's lots of breakdown of red blood cells. Another cause is that if there's an infection in the baby's blood, so it's also called sepsis. A third cause is if baby has an infection, for example, virus or bacterial infection elsewhere. A fourth cause, if there's an incompatibility between mommy's blood and baby's blood. Fifth reason is if the liver has any problem, so there's a malfunction in the liver. Number 6 is if there's a condition called biliary atresia. This is where the baby's bile ducts are blocked or scarred. A seventh one is if the baby has an enzyme deficiency, like G6PD. 8th is if there's any abnormality in the baby's red blood cells, causing them to be broken down faster than normal. Jaundice in newborn is not just about the skin being yellow and we are worried about aesthetics reason only. Actually, severe jaundice can lead to it can actually affect the brain and affect the child's development. Our Ministry of Health, we have a graph, call it a nomogram, that shows at what level and at what hour of birth and at what condition the baby is in that the jaundice needs treatment. So it's not just a graph that is, at this level you must treat it. It's actually not. It depends on how old the baby is and how is the condition of the baby. So we look at a few things and not just the number on the reading, okay? So apart from just measuring the bilirubin, so any child that is jaundice, us as doctors, we actually want to check the overall health of the baby. A physical exam must be done, and also how the baby's status is. So if the baby's feeling well, gaining weight well, and whatnot. So sometimes blood and urine tests must be done just to ensure that the baby is all right. The other thing is that if jaundice is not just the first few days of life, if jaundice persists longer than 2 weeks, for a term baby or longer than 21 days for a preterm baby, and that one also needs further evaluation. And for new parents, what are some of the signs that tells you need to see the doctor? Okay, so if you notice that the your baby's skin is turning more yellow, or secondly, if you see that it's not just the face, the baby's abdomen, the arms or legs start looking more yellow, that's concerning. Okay, it means that the jaundice or the bilirubin is more now, possibly more. Third thing to look out for, if the whites of the baby's eyes look really yellow compared to a few days before, just basically more yellow. Number 4 is if your baby look really tired, sort of sickly looking, very hard to wake up to feed, then you need to see the doctor as well. The 5th, if the baby is not gaining weight or is having difficulty feeding, very difficult to feed. Number 6 is if baby makes a really high pitch, very loud cry for no particular reason, just crying, very fussy, inconsolable fussing, and high pitched cry, so that's a sign to see doctor. And number 7 is if baby that has any other signs and symptoms that concerns you. So you're the parent, you have your instinct, right? The parental instinct. If anything is bothering your child, do bring to see the doctor immediately. Now the next thing is that some of the risk factors, we always talk about why this baby compared to this baby, why some babies are more prone to jaundice. So now let me go through some risk factors for developing severe jaundice. Okay, the first risk factor is prematurity. The earlier you are born, sort of not full term, so any premature babies, they tend to have also more premature or immature liver function. So that will again make the jaundice harder to clear, or the bilirubin harder to clear. Secondly, if a baby was born with a low birth weight. Okay. Third, if baby has any enzyme deficiency, specifically the most common one is G6PD deficiency. Number 4, if mother is blood group O. If mother is blood group O, or the blood group is the negative type. You know how blood group is positive and negative, right? So if mother is blood group O, and if she has a negative blood group type, also a risk factor for severe jaundice. The mother's blood may attack baby's blood, so that is what we call blood group incompatibility. Number 5, babies whose mother during pregnancy is diabetic or has gestational diabetes. Number 6, difficult breastfeeding. If baby is exclusively breastfed and the breastfeeding is so difficult, hardly anything gets into baby's system, then that is also a risk for severe jaundice. 7, severely ill babies who are septic or sepsis or has sepsis. That means that there's an infection going in the blood of the baby. So these are at risk for severe jaundice. Okay. And lastly, East Asian. So we are East Asian. So East Asian babies tend to also be more at risk for developing severe jaundice. Okay, so that are some of the risk factors. The next thing is very trendy, that people use this machine that you can test for the bilirubin levels without actually taking blood. So it's called the Transcutaneous bilirubinometer, or the TCB for short. We call it the Billy gun for short. It's quite accurate and correlates well with the blood test, provided that the levels are not above 200. Usually I say if the meter shows above 200, you do need to do a blood test to get a proper picture of how high the levels are. But if it's less than 200, it's quite it correlates quite well with the blood levels. Okay, so it's quite useful in the sense that it spares your baby from having to be poked, right? Because blood tests, you definitely need to poke the baby, which is painful, and which, you know, for a newborn baby's parents, it's very, you know, heartsick, you know, to get babies poked. So that's quite a useful tool to have to check the baby's jaundice. But just bear in mind, there are some limitations. It's not the most wonderful thing. There are some limitations. Again, if the levels are high, need to double check with the blood test. That is a must, okay? We are all doing this just to make sure baby doesn't have such high jaundice that may affect the brain. Now, also this meter, this transcutaneous bilirubinometer, isn't as useful if the baby has already done phototherapy. It is not as accurate when a baby has done phototherapy and the skin is already exposed to the UV rays, okay? It is just not as accurate. Another question I commonly get from parents is that can we just put baby under sunlight to help with the jaundice? So direct sunlight is not recommended. It's not recommended because there are you can't control the rays, obviously. Also, there are harmful UV rays plus infrared rays that may cause sunburn in your baby as well as overheating. So we don't really recommend putting under direct sunlight. The other thing is usually if we see that baby's levels are high enough to warrant phototherapy, admission to the hospital would be best, because staff in the hospital and doctors and nurses in the hospital can help monitor baby's vital signs and make sure baby is well hydrated and well fed. And also it ensures that baby gets the correct treatment, meaning baby gets good exposure to the phototherapy lights and all those things. So it's actually much better to be admitted if baby needs phototherapy. Lastly, this is just to, you know, another thing that parents say, oh, how do I avoid getting jaundice? In actual fact, the number one way to prevent jaundice is just to ensure baby gets fed properly. So ensure adequate feeding. If baby is breastfed, make sure the latch is proper and that baby is getting the adequate milk and there's good weight gain. So that's why we say proper follow-up with doctors or even the nurses, those visiting nurses, those are good, because we want to make sure baby is gaining weight. We always talk about gaining weight in the first week of life. What's the reason? That's because we want to make sure there's no problems with baby's growth, and hence no problem with jaundice. That's about it. So I hope you get some information from my short video here. This is just to alleviate some concerns that you have about jaundice and why doctor always check. There's a reason that we get concerned about jaundice, okay? Hope you have a great day. Take care.